Hi everyone, I'm here to talk to you today about biomarkers in prostate cancer. But the first question is, what are biomarkers? So a biomarker is any type of biological molecule which can be measured to reflect a disease or a physiological state. So your blood pressure, your glucose, and your pulse. These are all examples of common clinical biomarkers. But biomarkers are also really important in medical research for characterizing disease mechanisms and also in identifying drug targets. So I'm interested in biomarkers that are relevant to prostate cancer. And prostate cancer is the most common cancer in men in the UK, where here it affects around 1 in 8 men in their lifetime. The current screening strategy for prostate cancer involves a PSA test. So this involves measuring PSA in the blood. However, the use of PSA as a biomarker in prostate cancer is quite controversial, and here's why. PSA stands for prostate specific antigen, and that's exactly what it is. It's not specific to the prostate tumor, but to the whole prostate gland. The prostate gland has a very rich blood supply, so this means that there's always some level of PSA circulating in the blood. And on top of this, there are so many factors which can cause an upregulation of PSA, such as your race, your BMI, or presence of certain infections. So ultimately, it's just not very accurate or specific. This leads to two key limitations. The first one, the diagnosis of false positives and the subsequent overtreatment. And when I'm talking about overtreatment, I'm talking about invasive procedures such as the removal of the testicles, which is obviously not something we want to be doing if we don't have to. And secondly, late stage prostate cancers in some cases don't cause elevated PSA anymore. So in this case, these patients would go undiagnosed. So this is just screaming for the identification of new biomarkers in prostate cancer, and that's where my PhD comes in. So I'm looking at two potential biomarkers in prostate cancer, which we don't need to go into detail of right now, but it's important to know that they possess differential expression between the early and late stage of the disease. So in theory, we can measure the level of these genes in patients upon diagnosis, and then use this to stratify patients into different disease groups for prognosis, and ultimately use this in precision medicine to make better informed treatment decisions that are tailored to each individual patient. The ultimate aim of my PhD is the hope that this research can identify new disease mechanisms in prostate cancer and ultimately aid in drug development to help men live longer and better with prostate cancer. Thank you.